willingness to work for social justice and for changes that you won't see maybe in your own lifetime. If you think about it, the abolitionists who worked to end slavery in this country worked for decades, for centuries actually, before slavery was actually abolished in this country in 1865. The first African Americans were brought to this country as slaves in 1619. So for 250 years, most African Americans in this country were slaves. And the abolition movement began shortly after the arrival of the first slaves. So there were people who worked, as I said, for their whole lifetimes to try to end slavery and pass the torch on to the next generation. Likewise, if you talk about suffrage for women, women got the right to vote in 1920, the year my mother was born. But women had been working for decades for suffrage before it was achieved in 1920. So we know that there are lots of challenges that we struggle with, that we need to be persistent and determined. We have to understand that we may not, as I said, see the changes that we seek in our own lifetime. Tackling the challenges ahead of us, ensuring the safety of our communities, rebuilding our economy, improving our healthcare system, supporting our next generation of young people, all of this requires persistence and hard work. And it's not going to happen overnight. As I said, it takes sustained work. But if we continue to work hard, if we work together, our shared commitment to social justice can bring change to our communities and to our country. I want to thank you for inviting me, and I look forward to your questions. So since Randy invited me, he gets the first question.
So, President Preckwinkle, I had the chance last semester or last year to go to Washington, and I got bit by the bug, and I was like, this is what I want to do. Those who know me, I feel like I have good people skills, and I'm like, I think that's necessary for, politics. It's about out there meeting the people. But yeah, what would you say? How do I get started in something like that? Like, I mean, what path, like?
Well, I mean, clearly you're on one track, which is to get an education. I'm a teacher, I believe in education, so that's the first thing. Get your associate's degree here, and then a 4-year degree. It's not a requirement for office, but it's surely very useful and helpful. The second thing is, pick a campaign. Find a candidate you like and start working in the campaign. So you get a sense of what it's like. Because let me tell you, the joke I usually tell is, there are a lot of people who would be in elective office, who would be elected officials if they didn't actually have to run for office. It is important. It's important to know what campaigns are like and what you're getting yourself into. And I will give you an example of Kim Fox, my chief of staff. She's running for state's attorney. She wanted to do this 4 years ago, but her children were young and her mother was sick, and she decided she would wait. And she's run now. And I had a conversation with her a year ago in March, and I talked about what this campaign was going to be like. That it was going to be, incredibly hard work, long hours. And it's not just that you have to work hard and long, but you have to be on all the time. You have to smile, and you have to greet people warmly, and if you're having a bad day, God help you don't show it. And this race was going to be tough. It was going to be brutal. You were going to get a lot of tomatoes thrown at you, a lot of brickbats. Kim is a smart and talented person, but if you've never been in a campaign, it's hard to convey to people what it's like. And so I would recommend to you that there's 3 weeks left. All of your state representatives are running for re-election. Some of the state senators are running for election. There are several county-wide races, including state's attorney's race. Get involved in that campaign and see what it's like. Talking to people on the telephone, working in the campaign office. So you get a sense of it. Because in order to be an elected official, you got to campaign, and you should know what that's like. On the government side, as I said, it's important to be prepared by educating yourself as well as you possibly can. and also, paying attention to the public policy issues of the day. But most of all, I'd recommend that you get an education and get some campaign experience.
Thank you so much.
Okay?
Hello, Ms. Preckwinkle. On behalf of my wife, I would be in huge trouble if I didn't preface my question, and not just her, myself, with a huge thank you, because she is a 12-year employee at the ER at Stroger. And
Bless her.
she has been able to be the beneficiary, as well as me seeing the benefits of the changes you've made with the county hospital, and it is so appreciated.
Thank
So,
you.
and she gets to come home on time.
Credit where credit is due. Dr. Jay Shannon is the Chief Executive Officer of our hospital system, and he's worked very hard to improve the quality of care that's delivered and the working conditions for our staff. So,
Well, please thank them on behalf of my wife and myself. And my question, you mentioned as well the criminal justice system, because I'm currently doing my internship for addiction studies for CADC, and the one thing I noticed is where I'm doing my practicum, we have like 3 classes of youth who are being mandated to our facility for treatment. And my question, I guess, are there any plans or anything down the pipe that you are looking to do with the county justice system in terms of some type of rehabilitation or, equipping them to go out into, because just as you mentioned, the rate of recidivism, even I discharged a patient when I started, he's back already. So if there's anything planned in the future to help maybe alleviate some of the recidivism in that area.
there are a lot of people in this country who suffer with addiction issues. And one of the things we did when we created our Medicaid expansion program, County Care,
Right.
is include behavioral health services among the services to be provided. So behavioral health and substance abuse treatment is part of our County Care program, our Medicaid expansion program, again, for people 19 to 64 who make minimum wage or less. So we're hoping that through County Care, and we're enrolling people in County Care in the jail. So if you're in the jail and you're eligible and you're about to get out, we enroll you in County Care. So you have a neighborhood clinic to go to get your meds and to get behavioral health services. We've enrolled 10,000 people who are coming out of the jail into our County Care, our Medicaid expansion program thus far. And it's only if people get the meds and the behavioral health services that they need that they've got a real shot at not returning very quickly to the jail. Our county jail, I'm not sure what the most recent statistics are. The last one I remember is within a 3-year period, 52% of the people who are in jail now will be back in jail. And again, that's because a lot of them struggle with mental illness and substance abuse treatment, substance abuse issues. That's what brought them in the jail in the first place, and that's what keeps them returning to the jail. So we've put in our own County Care program, and it's not just our hospitals and clinics, it's 130 community-based health clinics, what we call federally qualified health clinics, FQHCs, and all the safety net hospitals and all the academic hospitals. So we have 8 hospitals and about 130 primary care sites, in addition to our own clinics and hospitals where people can go and get care.
All right. Thanks again.
Sure enough. Thank your wife for her service.
I will. I do every day.
Thank you again for taking the time to speak with us and also to answer our questions. I was wondering if you could maybe touch on what's at stake with regards to criminal justice reform in our upcoming presidential election.
So full disclosure, I'm a Democrat. And I am also a Hillary Clinton delegate. I have been a anxious observer of the Republican race for president. All I can say, Donald Trump is profoundly disturbing to me because I think he represents he represents sort of the worst of us. If you look at his attacks on immigrants, his attacks on, he made some snarky comment about a Chinese business person that I would call outright racism. He made comments about Jews that were stereotypical and discouraging, about women. And he draws very enthusiastic but monochromic crowds. I attribute it to the difficult economic times we're in, that so many people are insecure in their own economic situation and concerned about the future for their children. And I'm talking frankly about white people, because if you look at Donald Trump's crowds, there are very few people of color, if any, in the crowds that you see. We came out of, in 2008, they call it the Great Recession. So I'm a history teacher. The worst economic times in 70 years are not a recession, they're a depression. So we had a depression in the 1930s, we had a depression in the early 2000s. And we've been slow to come out of that. As I